Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Hello everyone, welcome to today's press conference. Je passe la parole au ministre Dominique Leblanc.
Alors, merci beaucoup, Corinne. Bonjour tout le monde, good afternoon. Today I'm joined by my colleague, Minister Anita Anand. Il n'y a pas de plus grande priorité pour le Canada en ce moment que de combattre et de vaincre la COVID-19. La COVID-19 a eu une incidence profonde sur la santé et la vie sociale et économique de tous les Canadiens. Yesterday, the Deputy Prime Minister announced an additional $7.2 billion in support for urgent healthcare needs across the country, the COVID-19 vaccine rollout, and for local infrastructure projects in cities and communities across the country. Our government committed to supporting Canadians during the pandemic, and that is exactly what we are doing. We will continue to always work collaboratively with provinces and territories to ensure that together Canadians get through this difficult pandemic. I would now like to invite my colleague, Anita Anand, to say a few words. Anita.
Thank you so much, Dom. Good afternoon, and thank you for joining us today. I have a brief update on the deliveries of vaccines to Canada. Since negotiating the early deliveries of vaccines in December, Canada has now received more than 6 million doses of vaccines to date. In fact, Canada's shipments of vaccines over the course of the next 3 months are expected to match the total number of doses received over the course of the past 3 months combined. That is 6 million more doses coming to Canada between now and April 18th. Les livraisons de vaccins au Canada au cours des 3 prochaines semaines sont en voie de correspondre au nombre total de doses reçues au cours des 3 derniers mois combinés, soit 6 millions de doses supplémentaires d'ici le 18 avril. Included in the doses that I just mentioned are the 1.5 million AstraZeneca doses from the United States that I can now confirm will arrive in Canada this coming Tuesday by truck. We have said from the beginning that the first quarter of this year would represent a period of increasing supply as vaccine manufacturers ramped up production, and this would be followed by significant supplies coming to Canada. We are now seeing that supply surge, and it is set to continue. Pfizer is providing at least 1 million doses a week from now until the end of May. Moderna is increasing the frequency of its deliveries from every 3rd week to every 2nd week, with 855,000 doses shipping the week of April 5th and 1.2 million doses shipping the week of April 19th. That is 6 million doses from Moderna and Pfizer alone in the month of April. Nous voyons maintenant une forte augmentation de l'offre et qui devrait se poursuivre. Pfizer fournit au moins 1 million de doses par semaine d'ici au mois fin mai. Moderna augmente la fréquence de ses livraisons de toutes les 3 semaines à toutes les 2 semaines. In speaking with Moderna executives yesterday, they assured me that their second shipment will come a few days later than expected due to temporary circumstances relating to the quality assurance process. As mentioned, we remain on track to receive 855,000 more doses from the company the week after next as scheduled. At the same time, as manufacturers stabilize their production lines, we are closely monitoring the global environment, including export restrictions in a number of jurisdictions. Our officials across numerous departments, as well as our suppliers, are working ahead of time to ensure that Canada's vaccines continue to arrive in our country. Not only have all the necessary export permits been secured for next week's shipments, but Pfizer has already received the necessary approvals for the shipments taking place the week of April 5th. Beyond seeing these doses coming to Canada, they also are being administered at increasing rates. Yesterday alone, 190,000 Canadians received a vaccine dose. 11% of the Canadian population has received at least one dose so far. Given the profound period of global demand for vaccine, there will continue to be bumps along the way, and we will continue to work every day to ensure that vaccines arrive in this country. As we have seen, these bumps are temporary and have not knocked us off course. And as I mentioned earlier, during the next 3 weeks, Canada is scheduled to receive the same number of doses that we have received over the course of the last 3 months. And this schedule will continue to accelerate. Indeed, my work every day is to bring as many doses of vaccine into Canada as early as possible. This is exactly what my team and I will continue to do until all Canadians who wish to be vaccinated have access to a vaccine. Thank you. Merci. Miigwech.
Merci beaucoup, Anita. So,
Thank you
Corinne,
very
we're
much.
happy to take questions now.
Merci. Nous allons donc passer à la période de questions. Toutes les questions aujourd'hui sont au téléphone. À
All
titre de
questions today
rappel,
are
on
on
vous
the
demande de
phone,
vous limiter à une
and we would
question et
ask
une
you
question
to
de
limit yourself
suivi
to one
chacun.
question and one
We will
follow-up.
now take questions. All questions today are on the phone. As a reminder, we ask that you limit yourself to one question and one follow-up question. Nous allons donc prendre la première question. Opérateur, c'est à vous.
Thank you. Merci. La première question, l'inaudible.
First
À vous.
question, Lina Dib. Please go ahead.
Oui, bonjour, Monsieur Leblanc.
Yes,
La question
Monsieur
va être à
Leblanc.
vous puisque
My
c'est
question
vous
is
qui êtes là.
for you
Il y a le
because you're the one
syndicat
who's there. There's
des agents des services frontaliers
the CBSA
qui
Border Officers
rapporte aujourd'hui
Union
que
that
dans
is telling
les
us
2
today
derniers
that in the
jours,
last
8000
2 days,
personnes ont traversé la
8,000
frontière
people
terrestre pour la
have
Pâque juive.
crossed
Pouvez-vous nous
the
dire qui surveille
land
cette
border
situation?
for a
Est-ce qu'on ne
Passover.
laisse
And
entrer
I
que
was
des
wondering what
citoyens
you would
canadiens
say about that. Is it
testés avec
only
un plan de
tested
quarantaine
Canadian
et qui nous
citizens with a
assure qu'il n'y
quarantine
arrivera
plan
pas un problème
who are
avec cette
crossing?
entrée
And
massive?
can that be a guarantee that nothing bad is going to happen?
Comme vous savez, depuis le début de la
Answer.
pandémie,
As you know, since
le
the beginning of the
gouvernement
pandemic,
a mis en place une série de
the
mesures
government has
restrictives
been putting in
précisément pour
place
protéger la
restrictive
santé des
measures
Canadiens.
to
À
protect the
plusieurs
health of
moments, nous
Canadians.
avons ajouté d'autres couches
We have
de
added
protection,
layers of
de mesures
protection
additionnelles
with additional
basées
measures
évidemment sur les avis des
at various
médecins, des
times
scientifiques,
based on the
que
advice of
les gens se
scientists and
présentent
doctors.
au poste
People
frontalier
who
terrestre.
are going
Il
to the
faut,
land
comme vous le
border
savez bien, il
entrance
faut qu'ils aient un test de
places must,
dépistage
as you know,
négatif
have a
à
negative
l'intérieur
screening
de 3
test
jours
that has
avant leur
been
arrivée.
performed
Et
within
ils
3
sont
days before their
évidemment
arrival
sujets
at the border.
à d'autres
They are
mesures de tests
also
de dépistage à
subjected
leur
to
arrivée
other
et des mesures
measures
de
such as
quarantaine.
screening tests upon arrival and quarantine measures.
S'il y a une augmentation de volume de Canadiens qui
If
veulent
there
retourner, par
is an
exemple, comme vous
increase
savez
in
très
volume
bien,
of Canadians who want to
la
come
loi ne nous
back,
permet
because
pas
as you
évidemment de
know,
retourner un
the law
Canadien
does
qui se
not
présente ou une
allow
Canadienne qui se
us
présente
to turn
à un
away a
poste
Canadian who
de frontalière
arrives
terrestre.
at a land border
Mais nous allons
wanting to come into
nous
Canada.
assurer que toutes les mesures nécessaires
We are
demeurent en
going to
place, ne
ensure
sont
that
pas
all of the
changées
necessary measures
pour
remain in place.
s'assurer
They are not
de la
changed
protection de la santé
to
de tous les
make sure
Canadiens.
that all Canadians' health is protected.
Alors, est-ce que vous pouvez assurer que
So can
ces
you
8000 personnes dont on
guarantee
parle,
that
ce
the
sont tous
8,000
des
people we're
citoyens
talking about
canadiens qu'on
are
ne pourrait
Canadian
donc pas
citizens who
retourner?
cannot be
Et
turned
Madame
away?
Anand, je ne sais
And
pas si vous avez un
Miss
update à
Anand,
nous
I don't know
donner
if you
sur
have an update to
le
give
vaccin
us
Johnson &
on the
Johnson et
Johnson &
qu'est-ce qui
Johnson
retarde
vaccine
le
and
fait qu'on
what
n'a toujours
is
pas de date de livraison.
delaying any delivery date for that.
Alors, Lina, moi, je parlerai un peu de la question des agents frontaliers et Mme Anand pourra répondre à la question des vaccins. Les règles n'ont pas changé. Il n'y a pas de tourisme qui est permis aux frontières avec les États-Unis. Ce n'est pas des Américains qui décident de venir en vacances pour une fin de semaine au Québec ou au Canada. Les frontières demeurent fermées aux touristes et des travailleurs essentiels et les Canadiens ou des résidents permanents qui arrivent au poste frontalier. Ceci n'a pas changé. Alors, il n'y a pas eu de changement des règles. Si des Canadiens décident de retourner pour une raison ou une autre ou de traverser la frontière, ils seront sujets à toutes les mesures nécessaires depuis plusieurs semaines, plusieurs mois, afin de s'assurer la protection de la santé des Canadiens. Alors, il n'y a pas eu de changement, d'allègement des obligations au poste frontalier. Et nous n'allons pas changer non plus ces mesures-là dans les prochaines semaines.
Merci. Prochaine question. Oh, no, sorry, Minister Anand.
Un moment. Oui. Merci beaucoup pour la question.
Thank you very much for the question.
J'ai récemment parlé avec le fournisseur Johnson & Johnson afin de faire pression pour obtenir un calendrier de livraison.
Get a delivery schedule.
Dès que nous les aurons,
and we've been told that we will get that information, and we understand that it takes time to plan to integrate a fourth vaccine into the province's vaccination program. But we will provide the information as soon as we get it. Thank you very much.
Merci. Donc, nous allons passer à la prochaine question. Opérateur, c'est à vous.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good afternoon, Minister. I'm wondering about the Moderna delays. I know you said last night that it has nothing to do with the EU export restrictions. I'm just wondering if you can go into any more detail about the assurances you received from the EU that they're not targeting us when they target to reduce shipments.
Well, thank you so much. On the subject of Moderna, I specifically raised the issue relating to the EU with the supplier yesterday, and Moderna confirmed that the delay of a few days is not related to EU restrictions. They have had those doses already cleared to come to Canada, and they will be arriving next week. And in terms of the EU itself, we're continuing to speak with our suppliers as well as our ambassadors. As you know, the Prime Minister also spoke with Ursula von der Leyen to express the importance of continuing to receive Canada's doses. That is doses that we have contracted for already into Canada. And as you can see, Ryan, the proof is in the pudding. We're receiving 3.2 million more doses next week and 6 million doses between now and the 18th of April. Thank you.
Yeah, just as a follow-up, I'm wondering if you sort of advised the provinces, obviously this delay hit this week. I know it's short term, but, there's vaccine nationalism, there's production delays, there's all kinds of things that can go wrong when it comes to deliveries. Have you advised provinces to expect this rollout to be bumpy at times, to see ups and downs from week to week, even if there's sort of a steady flow of vaccines?
Well, I will respond, and then I'll ask my colleague Dom LeBlanc also to respond, since he is the Intergovernmental Affairs Minister and speaks regularly with the provinces. But the reality, Ryan, is that this is a period of intense global demand for the same product. And as a result, what we have seen the worldwide is that countries are competing for vaccines. In this process, Canada is utilizing its diversified portfolio of vaccines to pull vaccine from multiple sources: Belgium, Spain and Switzerland, India, the United States. That's part of our strategy of diversification in order to manage the bumps that the international environment is presenting to us. We are working every single day to ensure that the vaccine doses for which we have contracted continue to arrive into this country, and that's exactly what you're seeing, the acceleration of doses from Q2 to Q1. We will end next week with 9.5 million doses in this country. 36.5 million doses prior to the end of June and 118 million doses prior to the end of September because of the aggressive approach that we are taking every single day, staying on top of this file and managing the bumps along the way. Dom?
Thank you, Anita. And perhaps I could also add our daily contact with provincial authorities around vaccine logistics, around the rollout and the ramp up, as Anita said, for the increasing number of millions of doses that will arrive in Canada over the next few weeks. This is an ongoing, active conversation daily. General Fortin and his team at the Public Health Agency of Canada have regular and ongoing planning meetings with provincial authorities. We recognize that as some of these inevitable ebbs and flows in terms of weekly deliveries occur, it's important for the provinces, as best as is possible, to have the latest information, to have visibility on when and how many doses will arrive in Canada so they can plan, obviously, the most effective and efficient rollout. So this is a very positive and ongoing collaboration. Obviously, when we receive news of changes or adjustments that are typical and that we had said would be an inevitable part of this global ramp up. As we receive that information, we immediately, obviously, pass it along to the provinces and work with them so they can do the most effective planning possible. And our information and our experience has been to date that the provinces are well prepared, are effective, have a series of redundancies in terms of their own ramp-up plans. So we're very confident that this will all go very well.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Prochaine question. Julie-Anne Lapointe, Radio-Canada. À vous.
Lapointe.
Oui, bonjour. Il y a l'Agence de la santé
Yes.
publique qui dit aujourd'hui que c'est vraiment
We
une
heard
course
today
entre les
that
variants et les
really
vaccins
it's
qu'on voit
a
en ce
fight
moment,
of
mais on
vaccines
n'est
versus
pas à l'abri
variants.
des imprévus,
And
là, nécessairement. Vous
there are all
appelez ça
kinds
des
of
bumps
unexpected things
dans la
that could
livraison des
happen. As you were
vaccins.
mentioning, there
Comment
are
alors
bumps
on
in
peut rassurer
vaccine
la
delivery. So
population que
how
la
can we
vaccination
ensure
va l'emporter sur les
that
variants?
vaccines will get
Peut-être,
the upper
moi, je pourrais
hand?
débuter si Anita veut ajouter quelque chose.
Answer. I'll start, and
Juliane,
maybe Anita can add
comme
something.
nous avons
Juliane.
dit depuis le début,
So as we've said from the beginning,
l'aspect global de l'approvisionnement des vaccins
the
nécessairement
global
va amener
aspect
des
of
ajustements d'une
vaccine
semaine à
supply
une autre
will
semaine.
necessarily lead to
C'est le
adjustments
cas
from one
pour
week
tous
to the
les
next.
pays au monde.
That's the case
Comme
for all
Anita a
countries in
bien
the
dit,
world,
qui cherchent
as
évidemment
mentioned.
les mêmes vaccins et sur
All
une
of these
base
countries are looking for the
prioritaire.
same vaccine.
C'est la raison principale pourquoi le
So
Canada, comme
that's
nous avons dit très
why
souvent,
Canada,
a
as we've
décidé
said a number of
délibérément,
times,
basé sur l'avis
made
des
a
scientifiques, des médecins,
conscious
d'avoir
decision
une
based on the
portefeuille
advice of
diversifiée, qu'on ne
scientists
soit pas
and of
dépendant
doctors
d'un
to
pays,
have a
d'une
diversified
compagnie,
portfolio, not
d'un
just focus
contrat
on one
pour
country,
pouvoir
one
vacciner le
contract to
plus
be able
grand nombre de
to
Canadiens le
vaccinate
plus vite possible.
Canadians
C'est
in the greatest
l'objectif de
numbers
notre
possible and as
gouvernement.
quickly as
C'est un
possible.
objectif qui est partagé
Our government's
évidemment avec
goal
les
is to do
gouvernements
just that. It's
provinciaux.
a goal that we share
La
with
Dr
provincial
Tam et
governments.
les autres
Dr. Tam
responsables de la santé
and
publique dans les
others
provinces
who are
ont
responsible for public
souvent
health in
dit
the
que le
provinces
plus
have
vite qu'on peut
said that
vacciner les
the
Canadiens
quicker we can
et le
get
plus grand
Canadians
nombre de
vaccinated and
Canadiens
the
qui
more
acceptent de se faire
Canadians
vacciner,
who
le
accept
plus
to get
facile ce
vaccinated,
sera de
the easier
maîtriser
it will be
l'arrivée des
to
variants. Alors,
control
encore là,
the arrival of
cela n'a pas
variants.
changé.
That hasn't changed.
On fait, je pense, assez bien
I
en
think
termes
that
d'avoir
we
des
are
vaccins
doing
le plus
a
vite
good
possible au
job
Canada.
in terms
Et
of
les
getting
autorités
vaccines into Canada as
provinciales font
quickly as
très bien
possible,
à
and
les
the provincial
administrer le plus
authorities
vite
are doing
possible
a very
aussi.
good job
Et nous
in
n'allons pas
getting
arrêter
those shots into people's arms
jusqu'au
as quickly as
moment où tous les
possible.
Canadiens qui voudront être
And
vaccinés ont eu la
we
chance
want to
d'être vaccinés.
really make sure that
Peut-être
all
Anita
Canadians
voulait
who
ajouter
want
quelque
to
chose?
get vaccinated will be able to. Anita, would you like to add something?
Oui, merci beaucoup,
Yes,
Dom,
thank
et
you very
merci
much,
pour la
Dom,
question
and thank you
aussi.
for the question.
Premièrement, Dom
First of all,
est correct. Nous avons
Dom is
renforcé la
right.
résilience
We
des
are
chaînes
going to
d'approvisionnement en
strengthen the
vaccins du
resilience
Canada grâce
of the
à la
vaccine supply chains into
diversification.
Canada,
Avec plus
thanks to
d'un fournisseur
diversification.
livrant au Canada,
With
nous
more than one
sommes en
supplier delivering
mesure de
vaccines to
garder le
Canada,
cap
we
malgré les
are able to
turbulences.
stay on course
Bien qu'il
despite
y a
turbulence, if you
toujours
will.
de la volatilité
There's
dans les chaînes
always volatility
d'approvisionnement
in
mondial, les vaccins
global supply
continuent
chains.
d'arriver au Canada.
Despite
Depuis
that,
cette semaine, comme j'ai déjà dit,
vaccines are
le
still
Canada a
arriving in
distribué
Canada.
plus
So
de
this week,
6
Canada
millions de
distributed over
vaccins dans
6
tout le
million
pays
vaccines
et
throughout the
plus de
country, and over
3,2 millions de doses
3.2 million
supplémentaires devraient
more
arriver
doses
la
should be
semaine
arriving
prochaine.
next week.
Donc ça, c'est
So
notre progrès, mais ça, c'est
the
aussi
progress we're
notre
making,
travail.
but it's
Et
our
chaque
work
jour,
as well.
nous
And
travaillons
every
sur
day,
cet
we
dossier
are
pour
working
s'assurer
on this to
tous
make
les
sure
Canadiens que les
that
vaccins
all
vont continuer d'arriver ici.
Canadians will get vaccines.
En suivi?
Follow-up question?
Oui, peut-être un suivi davantage
Yes,
pour le ministre Leblanc.
for
Votre
Minister
région,
Leblanc.
l'Atlantique, est citée
Your region,
encore
the
une fois
Atlantic
aujourd'hui pour
region,
sa façon
was
d'avoir répondu à la hausse du
mentioned
nombre de cas
today
de
as
variants.
being
Comment vous
for
expliquez
its
qu'ailleurs,
response
les
to the
cas de
high number
variants
of
sont
variants. So
préoccupants?
how
Est-ce que les
can you
provinces en
explain
font assez? D'après
what's
vous, est-ce
happening with these
que vous êtes
variants?
d'accord
Are the
pour
provinces
ne
doing
pas
enough?
relâcher les
Do
mesures
you
comme le
think
dit l'Agence de la
that
santé publique?
the measures should not be loosened?
Moi, je pense, si on parle de ma province, par exemple, au
if you talk
Nouveau-Brunswick, moi, je
about
pense
New Brunswick, my
on a eu un
province,
succès
there, I
important
think
à
that
maîtriser
it's a
l'arrivée
success
des
story.
variants,
We were able to get
à
a
essayer de
handle on
restreindre le
variants
nombre de cas de
and
COVID.
restrict the
Et
number
ça,
of
c'est
COVID
vrai
cases.
pour toutes les provinces de
And
l'Atlantique.
that's
Alors,
true for all
moi, j'ai
Atlantic
pleine
provinces.
confiance
So I
dans
am
les médecins, les
fully
autorités de santé
confident
publique
that
provinciales
the provincial
pour
public
leurs
health
décisions. J'ai vu,
authorities
par
will make the right
exemple,
decisions.
le nord-ouest du
In
Nouveau-Brunswick,
the
ils ont
northwest
changé
of New Brunswick,
le
there
niveau
was a
d'alerte à
change
cause
in
d'une
the
inquiétude
alert level
possible de
because there was a
variants. On
possible
a vu
concern
à
about
Terre-Neuve, par
variants.
exemple,
And in
qu'est-ce que l'arrivée
Newfoundland, we
d'un
saw what
variant peut
happened
faire en termes
when a
d'augmenter
variant arrived
rapidement le
there.
nombre
It
de cas, mais on a
made
aussi
the
vu un
number of COVID
succès
cases
très
spike.
important des
But then we
autorités
also saw
terre-neuviennes en
that
termes de
the
maîtriser la
authorities
situation. Alors moi, je suis tout à fait
Newfoundland were
confiant, pour
able to
répondre à votre
get a
question, je suis
handle
tout
on
à fait
that
confiant
situation.
que les
So to
autorités
answer your
provinciales
question,
à travers
I
le
am
pays
fully confident
ont
that
tout ce qu'il
provincial
faut
authorities
pour
throughout the
prendre des
country
meilleures décisions
have
afin de
what it
protéger leur
takes to make
population.
the right decisions to protect their population.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Next question, Glenn McGregor, CTV News. Your line is open.
Thank you. Minister Anand, despite what you've said about exports from Europe, it still is uncertain in the future. And can you tell me what kind of conversations you've had with Pfizer or Moderna about that possibility that exports would be restricted from Europe, what they would do in that case to fulfill their contractual obligations to Canada? Is there any possibility that it could be directed from somewhere else? Is there a possibility of supply coming from the U.S. directly?
Well, thank you so much. And Glenn, you're exactly right that this is an issue that we're watching very closely, as we must and as we should, given that there are new developments in the EU. Having said that, we are directly engaged with our suppliers to, first of all, ensure that our doses are ready to leave Europe. They're clearing the export control restrictions that Europe has set in place to enable them to leave Europe. And that's exactly what we have been able to manage with our suppliers. The doses have continued to arrive since January when the discussion of European restrictions began. And indeed, going forward, we've been assured that the doses have been cleared to leave Europe for next week and the week after. But again, it is a situation that we have to watch very closely given the intense global competition for vaccines. And as you suggested in your question, all options are on the table at this point. You have seen us, in the case of AstraZeneca, for example, pull that vaccine from multiple locations, from the Serum Institute, from this deal with the United States government, from our bilateral arrangement, from COVAX. We are diversifying all of our options at this point to make sure that we are going to continually receive vaccines into Canada from approved suppliers. And that is the work, as I said, that I do every single day and will keep doing until we have sufficient vaccines in this country.
We haven't heard a lot in the last couple of weeks about Johnson & Johnson, and could you give us an update on where discussions are about supply, when, how many doses could be expected, and when they would arrive, and whether or not they would be in any way impacted by European export controls as well?
Well, thank you for the question. And I have repeatedly stressed to J&J the importance and necessity of Canada receiving a delivery schedule as soon as possible. We are set to receive J&J doses in the second quarter and the third quarter of 2021. We are in total going to be receiving 10 million doses of the single shot vaccine. The precise delivery schedule is one that we still need to receive and, if necessary, negotiate, and we will anxiously await receipt of that delivery schedule.
Merci, thank you. Next question, prochaine question.
Thank you. The next question is from David Thurton, CBC News. Line open.
Hello, ministers. I hope everyone is doing well. I wanted to ask about the situation that's happening in Brazil. Yesterday, we saw over 1,000 cases. The death toll is the second highest in the world, possibly set to overtake the U.S. And the variant of concern that was found there is, of course, at play. So I just wanted to know, what is the Canadian government doing first to protect, Canadians, and also help curb the situation there?
Well, so obviously, and we've said this since the beginning of the pandemic, it's a global pandemic. So as we've seen, if it's in Europe, if it's in North America, in South America, there have been at different moments over the last number of months, very difficult circumstances. And Brazil is an important country. It's a large country. It has a big population, and they have suffered a great deal. It has been difficult in Brazil in terms of the impact of COVID. That's why countries around the world, including Canada, have had to stand up measures at our borders. And Canada has some of the toughest border control measures of any country. We have, from the beginning, had this 14-day obligatory under federal law quarantine for anybody who comes into Canada. We have closed the borders for non-essential travelers. So we've stood up testing requirements before one would board a plane to come from Brazil or any other country to Canada. We've increased measures at the border around testing at the point of arrival. The quarantine measures have remained in place. There have been some, including the Conservative Party, who think we should be loosening these measures, who are asking questions all the time about why aren't we reducing or eliminating important measures that we've put in place based on the advice of doctors and scientists to protect Canadians. So we obviously share the concern of all Canadians about what's happening in Brazil, but there are also a number of countries around the world that are also facing difficult circumstances, and that's why it's important to keep in place all of the measures necessary to protect Canadians, and we'll continue to do so for as long as it takes to ensure that every possible safety measure is in place.
David, do you have a follow-up?
Yeah, but does Canada need to do more? Do we need to take stronger measures? Argentina, we're hearing, is closing its border. Do we need to adopt measures that not only protect Canadians, but also send a message to the Bolsonaro government that what is happening there, that treating this like the cold or a flu is not acceptable?
Well, obviously the obligation for the government of Canada is to focus our energy on protecting Canadians, on protecting the health of Canadians, on providing the economic supports that are essential for Canadians and Canadian businesses to go through COVID-19 to support provinces and territories so they can provide the best possible health care necessary to protect Canadians in every part of our country. So our primary and most important focus is on what's necessary to protect Canadians. And the Government of Canada has responsibility for international borders. And that's why, as I said, we have put in place very restrictive, very effective measures based on the best medical and scientific advice we have. And we'll continue to improve those measures and leave them in place for as long as it takes to ensure the safety of Canadians. I don't think Canadians would find it particularly constructive for the Government of Canada to go around the world and point the finger at different countries of what they may have done or may not have done. Our focus is very much on what's necessary to protect Canadians. And obviously, like all other countries, we want this global pandemic to be brought under control and to be behind us in a global context as quickly as possible, because that's also in the safety interest and the health interest of Canadians to ensure that COVID-19 is under control and eliminated in every part of the country. But our focus has to be properly on what we need to do here in Canada to ensure the safety of Canadians, and that's exactly what we're focused on all the time.
Merci. Thank you. Operator, next question.
There are no further questions registered at this time. Il n'y a plus de questions à ce moment-ci.
Merci. Donc, étant à la fin des questions, ceci met fin à la conférence de presse d'aujourd'hui. Since we have answered all questions, this puts an end to today's press conference. Thank you.
Have a great weekend. Merci beaucoup. Au revoir, Anita.
Au revoir tout le monde. Merci beaucoup.
Goodbye, everyone. Thank you very much.
Thank you. The conference has now ended. Please disconnect your lines at this time. And we thank you for your participation. Merci.